Like what I said in the course of opening the show, I talked about World Cancer Day, right? And of course with the theme, I can and I will. Hope I'm not making a mistake with the theme right now. With me here in the studio to talk about this, I have Dr. Lawrence Igbinosa, consultant and HOD of Oral Diagnosis and Radiology, UBTH. Doc, welcome to TMI Sunday's edition. I appreciate your coming. So very close to him is the ED of IRECA, a non-governmental organization. Join me to welcome Madam Roslyn Odiase. Welcome to TMI Sunday's edition.
Good morning, Mr. Wilson, and good morning, viewers at home.
Okay, we've been hearing so much about cancer, this, cancer, that. Many have this vague definition of the word cancer. Some don't even know what it is. They only know it's as a killer. Doc, just to start off this show, because it's all about cancer awareness. What is cancer?
Cancer is actually a group of diseases involving abnormal cell growth, which has the potential to invade or rather spread to surrounding tissues. And when we say abnormal cell growth, we are talking about a kind of, it could be a form of swelling that we call tumor or neoplasm. But that there is a swelling or tumor does not necessarily mean cancer, because there are two forms of such. It could be benign, it could be malignant. If it is benign, that means it does not have the tendency to invade or rather spread to other tissues. And if it is malignant, it means it has the tendency to spread to other tissues. And if it is malignant, we call it cancer.
So if it's malignant,
malignant swelling, malignant neoplasms, or malignant tumors are called cancer. That means they have the tendency to spread to other tissues.
All right. Now you as an engineer championing the cause against cancer. I mean, in Edo State, what's the rate like?
The rate of
cancer, people are affected with cancer. I believe that you are in the field and you should know all this. Is it predominant in Edo State? Is it much in Edo State?
I don't think so. Because all I know about cancer is that cancer is deadly, and every year, like in Nigeria, over 100,000 diagnosed of cancer every year. And over 80,000 died of cancer. Like here in Edo State, there are ones that are more prominent here in more cancer that say yes. Like what I'm handling now, what makes me to come up and start talking about cancer is that the ones that are really affecting my own people, Edo State, Nigeria, is that of cervical cancer, childhood cancer, prostate cancer, liver cancer, and breast cancer. Like when we start talking about which one is more, I think breast cancer is more for women, prostate cancer is for men, cervical cancer, which I'm trying to set up a project with, that is the same because of the way it can be prevented.
All right. Now, which organs are affected? Because he mentioned prostate, he mentioned cervical, he mentioned some other kind of cancers like breast cancers. Now, are these only the part or the organs that cancer can affect?
Actually, so many persons have actually asked that question. But I want us to know that cancer can affect any part of the body, any organ, any tissue in the body. But there are some other some organs that are much more, that they're known for that disease. But the reason why some organs are more known for that disease is probably because of the functions of that organ. For example, if something is affecting muscle in the leg compared to something that is affecting the lungs that is used for breathing, you expect more symptoms to come from the lungs or more complaints, because it will be, the person can die any moment if the person is not breathing well. So generally, blood, it can affect the blood. If it is blood, if it can be, we call, most cancer that affect the blood is known as leukemia. And if it is skin, we call it melanoma. Cervix, you call it cervical cancer. And it could also affect the breast. Generally, we call breast cancer. For breast, can be male or female. Yes, but it's more in female. But for cervix, only the female, because only the female has cervix. Then prostate, of course, only the men, you call it prostate cancer. And several other cancers in the body. Any organ can actually be affected.
All right, people like saying that the rate at which cancer affects citizens, of course, in Nigeria is like in the increase sort of when compared to previous years. You get to hear this one cancer, that one cancer. How come it's like too common?
That is common now.
Yes.
Very well. If you see people coming out, like the other day, I was a specialist, and I was discussing with one weather professor and something. So while we were talking, a doctor, another prof came inside. He said, the rate, people are really, the rate, they discovered it before, but because we now hammer on it, it's when you talk out, people really know that. Like those in the Riverine area. So we just call me and say, Mama, you people are not coming to Riverine area. People are dying, we don't know. So there are issues that happen as regards cancer, they will not even know. That is why when we create the awareness, that is all about World Cancer Day. It has been on ground. People have been dying of cancer. People have been dying. It's not that cancer is new to Nigeria. No. Cancer have been on ground even before I was born. But the issue about cancer, that is why they say cancer is expensive to manage. Because it's only those that have money that are able to detect it early. Then they start managing it. But those that does not have money, they start just fall sick like that, gang. Before you know it, they will not even say it. Somebody called me from Riverine. He said our people die of this thing and they buried them. It's only when they start hearing of it that they start saying, hey, not true. They don't know.
Quite interesting.
It kills.
All right, now what are the signs of this cancer, doctor? People may tend to confuse the signs. So be like, no, this looks like witchcraft attack. This one is my village people. I mean, what are really the signs?
There are signs of cancer. To the public, I would say we should focus on symptoms.
Okay.
And symptoms are actually what concerns the people. Signs, whatever the doctor finds us in the hospital are signs. Now, what are the symptoms? How do one know that he or she has cancer or probably is faced with issues concerning cancer? Generally, I would say if somebody has unexplained weight loss, that means there is no reason whatsoever that you can think that is responsible why you are losing weight. So there might be a need for you to find out. Probably it could be cancer. Unexplained weight loss, fatigue, that is general weakness, general weakness of the body. The person needs to, when it is persistent, then low appetite. Somebody that used to eat often found out that person no longer feel like eating, and this one it keeps on and on and on. There's a need to worry. Night sweats, blood in urine. All of a sudden you find out that when you urinate, you have some blood, then blood in stool. And some of these ones could be visible. You can see blood in urine, you can see blood in your stool.
But still, all these signs and symptoms also, they're like symptoms of other diseases other than cancer.
Yes.
All right. So what should one do if someone start discovering, observing this kind of symptoms?
If there's hardly any symptom for a particular disease that you may not find in another. Okay. And when you have such, we say such a symptom or sign is pathognomonic for that condition. That is, that symptom, that sign cannot be found in other conditions. So generally, like I said when I was starting this, doesn't mean that when you have any of these signs that you just feel I have. No. What I mean is that it's possible that you have, then you need to go for a checkup. Unexplained weight loss, fatigue, general weakness, loss of appetite, night sweats, blood in urine, blood in stool. And when you have, when you have blood in stool, blood in urine, some of them can be visible. Sometimes they are not visible. By the time they see some other symptoms, they may like to do a test. So investigations in the hospital can reveal that there is blood is present in stool or present in urine. Recurrent nausea or vomiting. All of a sudden you found that nausea, you don't feel like I said before, loss of appetite, but then this time you're talking about something, you feel like vomiting. You see food, you just feel like you think you want to vomit. What are the other signs? What are the other symptoms? Sore throat. You have sore throat that is there and is not healing. You used to have sore throat before you apply a little major, it's gone. But this time you have it, but it's not going. Unusual bleeding and discharge. Generally, it can be from other areas in the body. Thickening or lump in the breast, for example. All of a sudden you find there's a thickening in the or a kind of lump in the breast. It could be male, it could be female. There's a need to worry. Go to the hospital for a checkup. Indigestion, difficulty in swallowing, for example. These are all things that we see. We can say as a symptoms.
Now if one should observe, or let's say, how will I put it now, get all these signs and symptoms, should one start panicking, or should he or she rush down to the hospital for, how will I put it now, check-up, so to speak?
Yes, like you said, rightly said, that most of these symptoms I'm talking about can be found in other ailments. So, like when you have a combination of this, the same you have this, you have that, you have that. So, or you are treating what you are thinking, and it's not just going. So there's a need to worry. So you go to the hospital. You are not the one to make diagnosis of cancer. It should be made in the hospital. There's no need to be afraid of anything. Even if it is made, there's no need to fear.
All right.
Just follow what you have been asked to do.
Okay, well, in our palace, talking about our own climate right now, it's not right for us to celebrate what we term evil. So how come we are celebrating cancer? I won't give it a day, World Cancer Day. Is it worth celebrating?
Yes.
Yeah.
Okay. Yeah, it's worth celebrating. You see, because I always refer from the developed country. It started there 2000. They started marking. Cancer is something that is not. It's a global thing. Yeah. It's not what we are doing that is only here that we mark it. It's all over the
world. In Nigeria, in Africa, we don't celebrate
to create
the awareness.
To create the awareness. Now you are talking about how do we know? Do you know why we don't? We're supposed to know, but we don't make use of the facility that will tell us, see what is wrong with you. Like when a child, there's, like I mentioned before, there's a childhood cancer. Like when you discover your child is not all that, you are a market woman, you go to the market, by the time you come, maybe the child is already sleeping. When you ask, the child did not, he say no, in body they ought, by the time you now say, if you know the child is sick, you come early from the market, maybe by 4 o'clock or by 3 o'clock, you go to the nearest PAC. That is primary healthcare center. You go there, there's somebody there. Or, how do I say it? There's supposed to be somebody there. Then you take your child. Because if we start saying, let's rush to General Hospital, let's just rush to UBTH, it will take time. Doctor, I don't think if I'm communicating.
Oh, you are, ma'am.
Okay. Like when we are talking about primary health care, this is where you start from. When we are talking about, when I'm talking about primary health care, I'm not talking about primary health care only in Edo State. There's primary health care everywhere in Nigeria. Even across. So when we know where to go. You can see your child is is doing, or you have cough, the cough is not going. You'll be taking drug, doing this. Then you have to look for, go to PAC. It is not all the time going to the chemist. You say this one, it's okay, take this. It will not go. That will now give the person another medicinal effect, side effect, but that will not stop the cancer. Because that is why we say, by the time doctor will tell you, what is wrong is a cancer. By the time doctor will come out to diagnose individual that is cancer, according to the doctors, they say it has spent 5 years. So it can be inside the body, it will be developing, spreading. So there is no way, all we are begging people, go for screening, check-up.
All right, for check-up.
Yes.
I'd like to say something about that.
Yes.
The world celebrating, yes, we could be celebrating successes recorded in the prevention of cancer and all that. But generally, when we say a day is being set aside, it's not in quote necessarily to celebrate. We say use the word mark. We 4th February every year has been it has been set aside as a date to mark that disease, cancer.
Yes.
What does it mean? It's the day is observed to raise awareness and to reduce the stigma that surrounds that disease, and also to encourage its prevalence and, of course, detection and treatment. Early detection, like Madam said, is the key.
Yes.
It needs to be detected early. You understand? So the date is set aside to mark that disease, means it is there to create awareness generally to the public that something like this is there, and again to put a check, because there's a target that the medical world want to get to. For example, the target of reducing the number of premature deaths from cancer and non-communicable diseases to about a third, that is 1/3, by the year 2020. So once in a while, it is good to come back and see, to the drawing board. Let's see, how far have we gone?
You use the word 2020, and we are now in 2021.
I know I use the word 2030.
Okay, 2030.
By the year 2030, we would have reduced,
right,
you know, the number of premature deaths from cancer and other non-communicable diseases by the year 2030. That is the target. So once in a year or once in a while, it is good to come back. This is our target for 2030. We are not going to wait till 2030 before we start seeing whether we've succeeded or not. So once in a while, it's good to come back to the drawing board, have a meeting like this, and discuss this. The rate at which we are going, are we really
progressing?
moving?
Yes.
That is where celebration comes in.
Okay.
Yes.
All right. Well, if you take a look at the topic, the process of vaccines in combating cancer. Now, you talked about the female folk, and we talked about cervical cancer, and for male prostate cancer. Where does this vaccine come in as an NGO? What have you heard about the vaccine? Because I heard about radiotherapy, I heard about removal of the parts and all that. So where does this vaccine come into play?
Yes, we say all about, like when we talk about breast cancer, you can do the test at home yourself, your husband, the loved one. Prostate cancer, which they say every man is at risk. When we say it's at risk, which means nobody, especially when it is also in the family. But when we now talk about cervical cancer, I'm so much concerned about it that cancer is preventable. Cervical cancer is the second highest killer in cancer.
Yes.
Remember, we have about over 100 types of cancer, different types of cancer. But I so concentrate on this. I want to concentrate on this cervical cancer because of the girl child. I was once a girl, and we know how we play our game then. But this time around, we were better then than the ones we are passing now. Now, and there is a way you can do it, because when I say, you ask a question, which one is more in our state here? Like cervical cancer is very common in the northern side. Why? Because of their exposure to sex at early stage. So when you look at it outside, it's the same thing. There's nothing, no, cannot say, my children are so bad. The Nigerian children, sometimes I begin to wonder when I see people say, I'm taking my child to abroad to train. You are taking that child to another barrack. So if you want to handle your girl child, my own part I want to play as regards this cervical cancer, which comes up as from the age of 9, because it was 11 before from developed world. They have taken it back to 9 years, where girl child can have it, the vaccine. And if that girl child have the vaccine, even if by tomorrow the person have the cervical cancer, it will not be as serious, because.
But many people are not aware of this vaccine. Is the vaccine in Nigeria, or it's just on?
It's in Nigeria. It's in CDC, that is a Center for Disease Control. It is in BMC, Benin Medical Care. You can get it there. So also outside Nigeria, outside Edo State.
But many parents are skeptical about this.
No, once you take it, once a child, because when you are expecting, not only 9 years anyway, like a advanced lady that is about 25, if that lady have not been exposed to having it, that is having intercourse.
Yes.
If that lady have not been exposed, which means there is no way he can have it. But if she has not been exposed, she can also go for it. Because the vaccine is my own target, is that I want every gay child should have it, so that even if it come up tomorrow, because it's not a total wipeout of cervical cancer to some, but if there is need for it.
All right.
There is need. We are going to go. By the time I started, even some
free?
people.
Okay, you just hold on there. Because people want to know if it's free. Anyway, just go to all these centers and find out for yourself if it's free. Because
it's not only in those.
She just kept quiet because, like, let me not say what to tie me right now. I understand. Now, Doc, she's talked about the prospect of vaccine, especially for cervical cancer, for ladies that are active in intercourse, especially for the younger girls, so to speak. Apart from this vaccine, what other aspect do you think cancer can be, treated? Yes.
There are three major ways we can treat cancer. One of them is surgery, that is by way of operation. One of them is chemotherapy, use of drugs, and one of them is radiotherapy, use of radiations to treat cancer. And I'm aware also that having known the risk factors that were mentioned earlier, we can actually do our best on our own, and that is where the public actually comes in. Do our best on our own to avoid, to prevent. Prevention is one thing we want to emphasize here, and also early detection. That is why these symptoms, people should just, when they have issues around this issue, they should report at the hospital. So generally, I would say those are the three major ways I know that we can treat cancer. On prevention, I also know that if we eat good food, actually the kind of food we eat these days is one of the reasons why many of our people are exposed to cancer. And people of old, the way they ate and what they ate is quite different from what we are eating these days. Apart from the fact that many of our foods in the plants, crops, they use some bad fertilizers to grow many of them. You find out that even when they get to the market, some persons should apply some kind of chemical to make these fruits, to appear, attractive, so that people want to buy. So all these, add up to expose us to developing cancer. So these are things we need to check. Then we're also aware of some very special food supplements which we will not mention at this meeting. If anybody wish to know some of these supplements to take to prevent, or rather to reduce the effect of cancer, you could call our lines. I mean, if they can call the Eureka office. They need me to, if she wants me to talk to them, she will give them a number to talk to them. Right. So we know of such supplement people can use.
Thank you so much, Doc, and of course, Edie, Eureka.
People can still talk, just say one thing.
Of course, you're going to use 1 minute each to summarize your point about World Cancer Day, and of course the fight against cancer, advice to Edo citizens and Nigerians in general, because we're being watched globally right now. 1 minute, Doc, you're going to have the last take on this. Let me start off with you. What advice do you have to our telling populace? We'll talk about fight against cancer.
Yes, Eureka, I'm all about health. And cancer is deadly, but it's not a death sentence. Early detection saves life. We don't have to start rushing to UBTH or know where you go first. Go to nearest PAC, primary health care center. If they are not working, they report some to me.
Wow. Okay.
Know what you eat, because according to what some of us, we are eating something that deposit radicals. They deposit radicals into our body. Okay. You know this thing is bad, you start eating it. Okay. At times you say, like when they tell us, like liver cancer now. Liver cancer is 100% preventable. You can prevent it, but what about what we eat?
Okay.
What if
Okay.
I've been exposed to different types of partner?
All right.
That's people that are infected with hepatitis B.
Hepatitis B. Okay, now if we want to go into this, we can spend all day talking about this because
So
we have other segments on this show.
Early detection saves life.
Early detection.
Please,
saves life.
everybody should have it in the back of the mind. Go to the nearest PAC sometimes and say,
right.
I want to check my breast. Please help me to open. Right now, I'm doing something
Yeah.
as related to this World Cancer Day.
Okay.
On the 7th, I will be in Ego. We are going to have an outreach
Outreach. Okay.
for World Cancer Day. So
All right,
if
thank you.
you can join us.
Thank you, because I don't want to go commercial right now. Thank you.
No, it's
I know. Thank you, Doc. You're going to have the last line on this discussion. Advice to our team viewers out there on cancer prevention and control.
I don't think this discussion will be complete if the people do not know how the disease, how does it even develop. So my last few seconds, let me use it to talk about that. Cancer develops actually when the body's normal control mechanism stops. What does that mean? If a man is short, maybe the wife is also short, they are likely to have children that are not tall. And if they are very tall, both of them, they are likely to have children that are not short. So, which means there is something in the parents they pass on to their children. That is to say that inheritance or genetic factors are some of the factors that have been implicated in the causation of cancer. So what I want to let the public to know is that when the body is unable to control, for example, a mass, when the tissues are forming, there's a point where the growth is supposed to stop. When it loses control, it just continues to proliferate, just continue to grow. So it grows beyond expectation and could form a mass of tissue. That mass of tissue is what we call swelling. But I said at the beginning, it's not all swellings that are cancers. And I also want to say here that not all cancers come in form of swelling. For example, leukemia is a cancer of the blood. It has nothing to do with the swelling. We also have cancer of the skin. It might not come with swelling.
Thank you so much. Well, you heard them. You heard about the prospect of saying just go out to these health centers and ask more questions or throw more light on it, or go to any NGO that has to do with cancer and of course health. They're going to throw more light on it. Okay, you can and of course you will. Yes. Cancer is preventable.
I will.
And of course early detection also saves life. Thank you, Doc. Thank you, for coming to today's show.
Thank you.
I appreciate your wonderful analysis. All right, up next, security situation in the country, contending issues, autumn statement, and of course, giving the ex-service chiefs a soft landing. It's like there's going to be a rowdy session in the Senate from the feelings we are getting. Anyway, my analyst will be the one to throw more light on this. Don't go anywhere. Do stay tuned.